this patient was referred to me for endodontic treatment of this calcified tooth number 9. As you can see, tooth is part of an old bridge, an abutment to an old bridge. And patient has symptoms, plus take a look here. There was also a labial pariolus associated with the tooth, and that's the tooth number 9. As you can see, the labial pariolus associated with the tooth also. So we discuss options with the patient. Let him know that I couldn't even guarantee that I could do the root canal because of severe calcification of the canal. You can see the periapical lucency here. But I'll do my best. I always tell my patients, I give them the worst case scenario because, you know, I want to make sure that they make informed decision. So patient said, please try, because this tooth is an abutment to a bridge. It's holding my bridge. If the tooth is lost, then the bridge is lost. So patient wanted to try to save the tooth. And that's what we did today. We went through his bridge, and take a look here. We were able to locate this canal in 2 minutes. Literally took 2 minutes to locate it. As you can see, everything went beautifully. Look at that nice bifurcation in the apical area. Snake tongue right there. Everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. Doing the root canal saved the tooth, saved the bridge, saved the patient a lot of money, pain, and suffering.